Welcome to the Beverly Hills Plastic Surgery Podcast. I am Dr. J. Calvert, today here to discuss some mid-face lifting and fat grafting with my lifted co-host, Dr. Millicent Rovelo. How are you, Jay?
I'm feeling quite uplifted, actually. Thank you for asking.
Yeah, you look lifted.
Well, thank you.
You're lifted for so many other reasons other than the mid-face lift and fat grafting, though. You do stuff to your face that I think I would cower and run to the emergency room and hope that I would be admitted for pain control. It's amazing what you do.
I am a user of our services.
You are. And by the way, you now have a disciple.
Who's that?
Our new PA, Lily.
Ah.
Guess what she did yesterday?
What did she do?
Morpheused her own face.
God bless her. Oh, man. She's become my favorite person.
A play right out of the Rovelo playbook. She pokes into the OR. She's got numbing cream on her face. She's like, yeah, I'm going to go Morpheus my own face. I was like, are you in the Rovelo fan club? Like, what is this deal? Like, how do you ladies do this to yourselves?
Beauty is pain.
Well, she's right there with you. So I gave her a commendation for taking one for the team, but she went and did it, and good for her. But that's not what we're talking about today.
No, today we are breaking down how to treat the midface, which is sort of the intro here. The midface being the area of the face in the middle of the face.
Wait, hold on. Are you talking about the middle of the face? Mid-face? That mid-face?
I am.
Oh my God. That is really,
All right,
that's profound.
I know. This is why I get called a smartass sometimes, but so a lot. So the midface is the area of the face between the lower part of the eyelid and like the bottom of the nose or the upper part of the lip. It's that junction that includes the lower lid and the cheekbone. And specifically, it actually includes that junction because that is a very distinct area of the face. Yeah, that's it right there.
I'm modeling it on this. If you're not on the YouTube channel, then you can see it right here.
Yeah, it's the midface. And let's talk about why we have problems there and then what we can do to address them.
Right, and the mid-face lift is something that is near and dear to my heart. I learned about it as a young medical student when Rod Hester, Mark Codner was a resident, as a matter of fact, and Sonny McCord in Atlanta were really diving into doing mid-face lifts through the eyelid. And they were doing little canthotomies or canthopexes and cutting the orbicularis oculi muscle and elevating the mid-face to the temporalis fascia, which we have done. We've done all kinds of versions of this operation. We do mid-faces around Roxbury, like some people do breast augmentations in their office. We really do a ton. But I learned about it then, and this is in 1994. It was a long time ago. Actually, it was 1993, now that I think about it, because it was like October when I went to Emory. And I saw just amazing results with what they were doing, and it enamored me because it was addressing a part of the face that was traditionally kind of left out of a facelift. Mm-hmm. You know, they would do coronal brow lifts back in the day. Now we do them endoscopically. They would do the upper lids. They do the lower lids through the lid. Now we do them transconjunctival, and then we do the lower face and neck. But this part of the lower lid junction would often look hollow after that. And so that's where this concept of mid-face lifting really came out of as a way to address a part of the face that was not getting the attention it deserved in terms of beautification and rejuvenation from a traditional facelift.
Right, because the problem here is that over time and with age, what happens is the soft tissues start to sort of fall off of the underlying bony structure of the face. So the fat and the skin that used to sit on top of your cheekbones starts to descend. So you start to get flattening of the mid-face part of your face. The other thing that happens is the lower lids. Sometimes you can see some fat start to herniate through the lower lid. So the lower lids get puffier. And so now you have this step off between the lower lids, which are a little puffy, and the fat, which used to sit right under them and support them, has now dropped, and you have this hollowing. So this is the hollowing that people try and fill with fillers, that they notice over time there's this hollow under their eyes. And it is simply related sometimes to genetics, but a lot of times also just to aging and gravity. That junction there is defined by a very distinct ligament, and it's not going anywhere. It is from the skin down to the bone. And so all of the changes that happen with aging really start to accentuate that ligament and that hollow. And so that is what is typically, as you mentioned, not always addressed in a classic facelift. Because a lower facelift, is really designed to address the neck and the jowls and the jawline, but it doesn't really do a great job at lifting the central portion of the face, which is the cheek.
No, and in fact, the way that traditional facelifters address the mid-face is they make the incision come up around the tuft of hair in front of the ear and up onto the face, and then they lift it that way as a skin lift, or even even a little bit deeper than that. You can do it a little bit deeper, but it gets dangerous with the branches of the facial nerve. So I hate those incisions. I don't think it's any mystery to anybody about how I design my facelift incisions, because I know I can do an endoscopic mid facelift or a canthal mid facelift. So I don't like cuts on the cheek and temple, and that is sort of the thing that people would do, is a cheek temple lift. So what we're talking about today, though, is whether you need to fat graft the mid face to take care of the hollowing that you've been talking about, which is really important, or if you need to actually lift the mid face with an operation, because those are two ways that you can address it. And truth be told, a lot of people don't do mid facelifts.
Yeah.
This is an operation that is pretty rare, and it's part of the fox eye procedure that I do. It's part of the this is something that for me, it's like riding a bicycle. I love doing mid facelifts, and I think I have a TikTok that goes like, I love the mid facelift. Like, I'm just like enamored by it. But you don't always need to do that. Sometimes you can do fat grafting. And what in your mind, Dr. Rovelo, what's the differentiating fact that says to you, I should probably fat graft this person, as opposed to doing an endoscopic operation where I dissect through their whole face and lift the mid face?
It really depends on the severity of it. I mean, if the tissues have really descended and they are super hollow, fat grafting probably is not going to cut it. But the other thing too is sort of what's going on with the lower lids. If there's something that's happening with the lower lids that needs to be addressed, it kind of makes sense to just go in and do the mid face while you're there. Now, sometimes when you do a lower lid and say you have some fat that's herniating out, you can release the ligament that's really tying things down and separating the lid from the cheek, and you can redistribute the fat that's already there and sort of camouflage it. So there are some things you can do while you're doing the lower lid, but a lot of times combining the lower lid with the mid facelift is really effective.
Yeah, I mean, that's, for me, you get so much out of a mid facelift that's related to the lower eyelid.
Yeah.
You shorten the distance from the lash line to that tear trough or the dark circle. Like, people say, is there a treatment for dark circles? Yes, it's called a mid facelift, and they don't want to hear that. They want to, like,
A little filler.
oh, just
A little laser.
can I just put a little cream on it and just get rid of it that way? No.
Short answer,
It's just,
no.
you can't. The dark circles, the only thing that you can do is make the dark circle smaller by elevating the cheek, releasing that ligament, getting, coming across that infraorbital rim and releasing all the tissues, so that when you lift, that lower lid shortens, it gets smaller, and then your dark circles are improved because you've put your cheek tissue up where your long your
Eyelid. LAE.
LALL, your long ass lower lid, I think that's what I was trying to go for, is now shorter. And so you want to do that lift, and you'll get great results with this. My patients love their mid face lifts. They really are into this, and they like the fact that the lid is shorter. They like that the cheek is up. It usually is combined with a lateral brow. It just makes you look better.
It makes you look better. And if you're treating this area as an isolated area, so if you're not doing a lower face, I think this is an excellent option. If you're already doing a facelift and the mid-face and lid chink junction is not too bad, then fat grafting is actually not a bad option because you're already kind of redistributing some of the tissues, you're bringing them back up. So if a patient doesn't want to do the whole shebang of a lower face and a mid-face and an upper, and they just want to do the lower face and then throw some fat grafting in, that's a reasonable option as well. I actually like that option, I think, more so in men. You can certainly do mid faces in men, but it definitely is a more, I don't want to say extreme, but it's definitely a different look because it, like you said, a mid face is part of a fox eye procedure. It kind of gives you that more exotic, full cheekbone, kind of sculpted eyelid look. And some men need that, but if they don't need it badly enough, it can kind of feminize them a little bit too.
Yeah, I mean, it's all about the diagnosis. It's all about understanding what's going on, with the tissues. This is where, evaluation of your patient and what they are trying to achieve really is key. It's the understanding how to assess the tissues, assess their positioning, understand what your operation can do. There's a lot to it, and that's why I think when you're coming in for facial rejuvenation, the question should be, well, the first thing that the patient should really say is like, these are the things that bother me, and then what can you do about them? Not saying I need this or I need that, because you don't necessarily know that exactly. You probably have a good idea. Yeah. Like, I mean, there's going to be somebody who listens to this operation, be like, I want my dark circle shorter. I hear you, right? I want a mid face. So yeah, and that's it. But then it should be, and what else though? Like how am I going to look my best? Because these operations performed in a vacuum, one by one, doesn't always result in the best look for the patient. So you do have to kind of take facial harmony into account. You have to take the artistry of the procedures into account, and maybe you don't need a 4-lid blepharoplasty with every mid facelift. I mean, maybe you don't need upper lids done. Maybe you need them done later. Maybe you don't need a lateral brow. Maybe you just need the mid face. So it's like there's a lot to it, and it's all about what's going to produce the look that you're looking for. And as we always say, take a look at the before and afters on the website and the Instagrams, and on our Instagrams anyway. We've already hashed that out, that some Instagrams are truer than others, but on our Instagrams you can count on them being sort of the raw photos. This is where you get the information. You need to know, like, I want to get from here to here, and this is what I think. What do you recommend, doctor?
Yeah, that's 1,000% how I do my consults for the face. I give a patient a mirror, I have them look at it, and I'm like, tell me what you don't like about your face. And they'll say, I don't like my lids, I don't like, this hollowing here, I don't like my neck, I don't like my chin. Great, here are your options. This is how we can fix all of those things. And sometimes they're on board to do all of them. Sometimes they're like, well, let me just focus on the lower face. All of that's fine, right. But they just need to know what their options are. And a mid face it's not a nothing surgery. So if you're thinking about what your options are, you do have to know this is a very real surgery. It has very potential risks for issues and complications. So you have to know that this is a real surgery. It is going to be more than just putting some fat grafting. So not everyone's up for a big surgery. So all of these factors go into what the patient ultimately decides to do. I like the mid face because I think that it, as I've said many times before, it corrects the problem as opposed to camouflaging it. I'm all about fixing what's wrong. The mid-face fixes it. Your face has fallen down. The mid-face pulls it back up. It's very simple.
Straightforward.
Whereas fat grafting doesn't do that. It doesn't fix the problem. It just sort of camouflages what's going on. So everyone's going to have their preference. Every surgeon's going to have their preference. And as long as you like the results of the surgeon you're going to, in some ways it doesn't really matter too much as long as they can deliver the results that you want.
Yeah, and getting back to fat grafting, yesterday I did a lower face, neck, lateral brow, mid face, upper lids. The lower lids weren't that bad. So it was like a lot to have to go through the lid. I put a little fat grafting along the rim here and down in the cheek and pushed it up and
it was great.
Bob's your uncle. It looks amazing. It was exactly what she needed. And that's where, knowing those options and, could I have done a lower lid bleph? Well, sure, but it wouldn't have addressed anything. Yeah. So it's like, you don't just operate to operate. And I know that there's like, how many surgeons, say this, well, I did my operation, which is like, this package of things and that's it. And they just do it for everybody. I think that's short-sighted. You're going to overdo things. And at some point you're going to have a problem with something that people are going to be like, why would you have done that anyway?
Yeah.
That didn't make sense. You want to be smart about these operations.
These are bespoke operations tailored to you.
100%. And the mid-face is just, it is a great one. It does make people look younger. I mean, I do it for patients that are in their 30s very frequently. And then, I include it in operations for people up into their 60s. And, if it really is going to help address their aesthetic issues, it's a great thing to do.
Yeah. Well, I couldn't agree more, and I'm glad we talked about this.
Well, good. So this is the Beverly Hills Plastic Surgery Podcast, coming to you from the 90210.